Good day. I'm Fieggen from the Division of Neurosurgery at the University of Cape Town, and it's a great pleasure to be part of the session looking at challenging practices in Africa, and specifically the question of epilepsy surgery in Africa. And while we're talking about neurosurgery in Africa, it's worth remembering that the first recorded evidence of cranial surgery ever undertaken, in fact, took place in Africa more than 10,000 years ago. So as we've just heard from Professor Cross, there's a well-established routine that's followed in patients who are candidates for epilepsy surgery around the world. Clearly, it all starts with a clinical story and the clinical picture, and if that matches an EEG, MRI scan, and in many countries neuropsychology, patients may be candidates for surgery which, as we've heard, in many cases is in fact curative. But before we talk about epilepsy surgery as such, it's worth remembering that many patients with other neurosurgical pathologies may present with seizures or with epilepsy. And in a sense, that's really the low-hanging fruit. The first challenge that any country that's developing neurosurgery needs to look at is being able to identify those patients who've got brain tumors or brain abscesses, tuberculomas, who present with seizures who are easily cured by a relatively straightforward neurosurgical operation. So before we look at neurosurgery more broadly, I'm going to concentrate on three examples of African programs that have been able to introduce epilepsy surgery in three different settings with perhaps an increasing level of sophistication of the neurosurgical environment. So the first example is Cure Children's Hospital in eastern Uganda, a remarkable institution where there's a pediatric neurosurgical program established by Dr. Ben Worf and continued by Dr. John Mugamba, who trained with us in Cape Town. At Cure, they established the program with the help of colleagues at the University of West Virginia, screened a number of patients from around Uganda and found 10 that were candidates for epilepsy surgery. These individuals had all undergone CT scans, all had evidence of hippocampal sclerosis on CT scan, and EEGs had matched that. And of the 10 patients that had surgery, fully 6 were rendered seizure-free by their surgery, which is a remarkable achievement under very adverse circumstances. The next example that I want to look at, a similar collaboration between, once again, the University of West Virginia and University of Alberta with a group of neurosurgeons in Karachi in Pakistan. A big department of neurosurgery with very well-trained neurosurgeons, but not with any experience previously of epilepsy surgery. And in that setting, draining a very large population in Pakistan, they were able to select a number of patients who were candidates for surgery, and of the 16 who underwent surgery, 13 were well controlled. And I think it's a very good example, once again, of collaboration that enabled a local group of neurosurgeons to develop the skills to do this kind of surgery. The last example I want to end with is from Tunisia, perhaps the most sophisticated situation where there was a very close relationship between a hospital in Tunisia and a hospital in France. Patients were screened in Tunisia, underwent video EEG. Using internet technology, those EEGs were interpreted in France, and patients were selected for surgery. And of the group of patients who underwent surgery, absolutely all of them were rendered seizure-free, which is really a remarkable achievement. So moving from the specific focus on a few examples where epilepsy surgery has been undertaken in Africa, let's try and get a bigger picture view. And if one looks at neurosurgery in Africa, one has to remember that many countries have very few neurosurgeons. And this is very nicely illustrated in this example by Professor Kamalichi 11 years ago. We divided the countries of Africa into 4 different groups depending on the number of neurosurgeons. Group 1 is countries largely in the north and the south where there's a reasonable number of neurosurgeons, and those countries really are not the focus of the discussion today. The second group are really the countries where there's real possibility of developing epilepsy surgery because there's a fair number of neurosurgeons, there's good neurosurgical infrastructure, and there's certainly the capacity to develop epilepsy surgery programs in combination with colleagues elsewhere in the world. Group 3 are countries where there are very few neurosurgeons. Happily, many of these countries, more and more neurosurgeons being trained, but they're still grappling with the overwhelming burden of disease that they have to deal with, and the chance of developing sustainable epilepsy surgery are probably very slender. And then sadly, lastly, there's a group of countries that have no neurosurgeons at all. So is there a role for neurosurgeons in Africa if you consider the fact that there are countries that have no neurosurgeons? Do any countries need neurosurgeons? Well, I think you can answer that with a resounding yes. If you certainly look at the patients that are out there, the burden of disease, patients who sustained head injuries, suffered intracranial bleeds, And as this meeting knows all too well, patients with epilepsy who may well be helped with surgery. So there's clearly a compelling case to be made for individual patients with these very common diseases. Certainly for the doctors, they're very competent and capable doctors in many of these countries who require the services of neurosurgeons, and in many cases well-trained neurosurgeons who develop in collaborations with other colleagues and putting health systems in place that are going to enable them to offer safe and effective neurosurgery. But what kind of neurosurgeon does one need? If you have a situation where you've got very few neurosurgeons, should one have an abbreviated program where we produce many neurosurgeons who can go out there and start tackling the vast number of patients who need treatment? Well, I believe the answer to that is most definitely no. Neurosurgery, like many other specialties, is really an all or nothing phenomenon. You need to be properly trained. And I firmly believe that having a partially or incompletely trained or inadequately trained neurosurgeon is probably more dangerous than having no neurosurgeon at all. And the challenge for us is to make sure that we train neurosurgeons adequately who can return to their countries of origin and start to develop training programs, start to advocate for the services they require in their countries. And that's the only way we're really going to make progress in advancing care of patients with neurological disorders in Africa. So if, to conclude, one looks at the barriers that we have to overcome in doing that, well, I think they can be broadly divided into four main areas. There's clearly, as we said, a small base, in that there are in some countries very few neurosurgeons, and most African countries have been affected by the diaspora, where well-trained professionals have gone abroad and have not returned. I think the tide is turning in that respect, and many of those individuals are looking to rebuild links with their home countries, and that's a resource that in many respects has not yet been fully tapped. But there certainly is tremendous potential to develop links with people who've gone abroad in that sort of way. Secondly, in many countries, sadly, there's still a lack of support, a lack of understanding of the services that are required, inadequate equipment, and difficulty procuring the kind of basic equipment that's needed. Oftentimes, you don't need very complex equipment, but just getting the basic equipment can be an insurmountable challenge. The distances patients have to travel, and often the distances between different centres mean it's difficult for professionals to interact. And obviously the internet is playing a big role in overcoming that particular hurdle. And lastly, I think a nettle we have to grasp is poor cohesion and the lack of a unified neurosurgical group within Africa that can enable one to develop training programs and communicate across borders. That's based on historical differences, geographical divides, linguistic divides, different organizations that have developed over the years, that people having different affiliations. But Africa really badly needs a single neurosurgical organization that will enable us to work cohesively to tackle the many problems that we face and can be successfully dealt with. And to end on a positive note, I think that I would really like to echo the words of Professor Gallo Diop yesterday when he said that things are really moving. There's no doubt that we are in a situation where increasingly more and more well-trained professionals are finding their way back to their own countries. And I'm sure when we reconvene in 10 years' time to relook at epilepsy surgery in Africa, there'll be an awful lot more countries that are able to offer safe and effective surgery to patients with epilepsy. Thank you.